Hello there. Welcome to yet another episode of Skills Lab sessions. So with me today, we'll unveil the stethoscope with part of the equipment that are required. Okay, so what I have in particular in my hands is a Littmann stethoscope, which is a recommended stethoscope for clinical practice. So this stethoscope has parts. As you can see, we have the diaphragm and we have the bell. Through the same bell, we'll have a stem which connects running through the tube to the earpiece. Okay, the next equipment that we'll go to is just the replacement parts of the stethoscope. So these do wear out in tear with the duration of use. So these are just the replacement parts. Our next equipment is the tourniquet. So for a tourniquet, it looks like this. So these are the latest tourniquets that are available. Clinical practice, we mostly have the elasticated ones, but there are these new tourniquets. And the next equipment is a pulse oximeter. So a pulse oximeter looks like this. So that's digital, one that we have today. Yes, so I'll show you a demonstration of how you put it. So you use your index finger to be placed just the way I've put it, and you wait for it to give you a reading. So it's automated, it will give you a reading of your saturations. So the saturations vary from all the saturations as oxygen. It will look at everything to do with your pulse. Just in a nutshell, within seconds, you'll be able to interpret all those with your pulse oximeter. Okay, my next equipment is a patella hammer. So for this one, we use it to assess reflexes and any neurological examination. So with this one, you have to take precautionary measures in that you just don't hit in that because it's called a hammer, no. So it's supposed to be a gentle procedure to assess the reflexes and any other neurological assessment. Okay, so the other equipment that we are unveiling is the pen torch. So for this pen torch, it can be used with so many different functions. Functions that will come with the neurological aspect of assessing the papillary reflex. Your pupils, we get to use this. Sometimes as well, we have brain stem death. We want to assess the eye response to light. So we just want to assess. It can also be used as a general aspect of assessing the skin. If you have any lipomas per se, you're able to assess. So it has so many multiple functions which vary, but it's a must-have for clinical practice. Yes, the other equipment is a mercury thermometer, just like this one. So mercury thermometer in itself is, it has different parameters and landmarks of where you get the accurate. So in this specific type, we use the auxiliary. Under your armpit, just there, we put it, and then you'll be able to assess. So the mercury, when triggered by the core temperature of the body, it will start elevating to a specific one where you get the reading of the temperature. Yes, also a must-have for clinical practice. Yes, so the other equipment of interest is our measuring tape. So our measuring tape can come in all shapes and sizes. And this type that we're having is just an ordinary one that can be used to measure the length in pediatric. In obstetric and gynecology, you use it to measure the gestational age, which is the visual-fundal height. It can be used to also look at the limb length. It has so many functions. The pediatric setup, you can use it to assess anthropometric measurements, such as head circumference, and many more. It's also a must-have. It's highly recommended that you have this in your kits. Yes, so we come to the end of another episode of our session. We hope you enjoyed. Please like, subscribe, and share. Thank you.